Hello and welcome to Inside Liberia. It's good to be back here on a special edition this morning. Today we have with us in studio um, Mr. Josh Paul Williams, and we want to say welcome to George, and we also want to say welcome to Lester, to a radio correspondent in Maryland County, Liberia. Today we will be talking about the challenges and the prospects in the Liberia's health sector. And Mr. George will tell us who he is, or Mr. Williams. Let me not go into that. But just stay tuned, share the video, and be part of what is happening this morning. And asking all the wonderful questions this morning will be Mr. Lester Joe Wilson. Lester, you are welcome.
Thank you ever so much.
And I
So let
want
me
to
say thank.
yeah, go ahead.
Yes, let me say thank you ever so much for the opportunity.
You are welcome. And I want to say a special welcome to Mr. Williams this morning. We're going to give him time to just introduce himself properly, so those that are watching him for the first time will know who he is. George? George, can you hear me? George. George is kind of frozen a little bit. I will go back to Lester. Lester, you want to just tell us who George is before we can get him, back on
Well,
online?
well, George Williams, I am sorry for the internet, but George Paul Williams is the Secretary General currently of the National Health Workers Union of Liberia, and he served the position for some years now, and currently he's still in Germany as a Liberian nurse. And I understand that recently he participated, either he's participating or he's participated in the World Economic Forum held in Switzerland. So probably he will be telling us more about all of those, and maybe we talk about the prospects and challenges associated with the Liberia's health sector, particularly health workers who I honor his control as an advocate. Um, yeah. So we
Oh,
hope that he comes up soon, that we kick off the discussion.
oh, that's good. That's good. George, can you hear me? Hello, George. George, this morning, if you are just joining us, this is to a radio and TV, and we are here this morning with in our studio, Josh P. Williams. He is the Secretary General of the National Health Workers Union of Liberia, and our discussion centers around the challenges health workers are facing and the prospect that others can tap into to make the health sector a better one. Currently, we have this interruption. We have uh, the line is a little bit frozen. George is calling from Germany, where he's doing, he's spending some time studying. Hopefully, we can have him back online. George, can you hear me?
So while he's away,
Yeah.
yesterday we visited a village here in Maryland County called Nemeken, which is bordering the Ivorian, border, and is few miles away from Plymouth. There is a clinic that was constructed during former President Ellen Johnson Sirleaf administration,
Mm-hmm.
so as to cater to, I understand, about 7 communities on Asa, including Yolokboken, Racktown, Kunokuli, Kavala Kunokuli, Woteken, and other Liberians who are living across the river, that is on the Ivorian side of the river. But since the construction and dedication of the clinic, um, there has been report that the clinic has not been full functional. In fact, what we were told by residents of the area is that people from Plibo Health Center, that is the Maryland County Health Team, sometimes they
Yeah.
do an outreach treatment either once or twice a month. So they were like saying it is not sufficient because you have some pregnant women on 2 occasions that one of them recorded, why coming to Plibo, they have to give birth on the way because of the lack of treatment at that area. Because according to her, they have to pay 600 Liberian dollars from there to come to Plibo. So to go and come is about 1,200. And sometimes after the prescription, you may not see the medication needed. So they will
Yeah.
have to issue you a paper that you have to buy your own medicine. So a person who is selling probably sugarcane or yes, cane juice, surviving from cane juice, to pay such transport think as happening with Mr. Williams when he comes up, we can address all of these, how the Health Workers Union um, is addressing all of these with the government of Liberia politely and maturely to ensure that some of these problems are addressed.
Yeah. Hopefully. Of late, there have been a lot of reports from Liberia. So there are so many questions that one have in mind as it concern the healthcare workers, their their well-being, at the same time, their their job and the professionalism that is applied.
Yeah,
They're getting the proper training. Are they, have that regular, regular, regular training, like, monthly or maybe like every 3 months? Because if you're in the health sector, there are new things that are coming up every day. Every time, there are new technology that is being developed, and you have to keep your people updated. So those are the questions that, some of the questions that come to mind. Mr. Williams, you are welcome. Good to have you back.
Thank you so much. Sorry that I slipped up, and then I found out that I was in the wrong room.
Yeah,
So
that's understandable. Can you tell us, just briefly introduce yourself, because you have been off and oh,
yeah, so I am George Paul Williams, and I serve as the secretary. I'm a professional nurse and a social worker, and of course a trade unionist. And I serve as the Secretary General of the National Health Workers Union of Liberia, NAWU. Um, yeah, so that's who George is, a son of Maryland County from a village called Doloken in Kalue District, and I'm a Liberian.
thank you so much.
Yeah.
Lester, you
yeah.
can start. Yeah.
So Mr. Williams, welcome to this special edition of our broadcast.
Thank you so kindly.
Oh,
All right.
before you
So
go
let's
through,
begin.
before 1 minute lesson, I see Mr. Nippon. Is he part of the discussion, Williams?
Oh, okay. Mr. Nyepon is one of the officials of the health workers office in Monrovia. I
Okay, that'll
think
be
it's
good to have
because
you.
this link I showed it the people that we were going to be online. So I don't know how they are supposed to follow.
Oh, I'm
Those
going
who
to
want to
send
follow.
the link to you. You can send it to them unless they have something to say. If they
Okay.
want to say something on the platform, then I can bring them in. Is that what you want?
Okay. They wanted to follow. They just wanted to follow. And yes, maybe some people will make call if there is a way
So
that they
they just
can.
go to let's just go to 2A radio and start to follow from there.
Let me
Okay.
say the link, George. I think I did. You can forward that link to them.
Okay.
Yeah,
Okay. Thank you so kindly.
you're welcome. It's good to have you here this morning.
All right.
So, like as I was saying, you participated um, in the World Economic Forum from Liberia, and I guess there are other things that were discussed. Could you give us update from Switzerland?
Okay. So thank you so kindly. Actually, I went to the World Economic Forum as an uninvited guest, but I told you
Wow.
already I am a trade unionist. And so
Hmm.
I went there from the trade union background,
Hmm.
owing to the fact that when you talk about the World Economic Forum, you are talking about a global event wherein the issues surrounding the economy of the whole wide world
Hmm.
is being discussed. And we know that workers are the ones who make the economy to work. Unfortunately, at the World Economic Forum, there can never ever be workers. And so it is from that perspective that I went to the town of Davos in Switzerland. I had to travel 5 hours by train from Geneva to reach there. And I went there to protest against what was happening. First and foremost, against the fact that certain people, in the name of innovation, have patents on basic medical supplies and remedies that people could use to get well, but they decide to patent them, keep them under restriction because they feel it is innovation. So they must make profit, they must make money at the expense and the lives of millions of people across the world. Being a nurse,
Hmm.
end user of vaccines and medical supplies for patients, seeing what had happened in the last 2 years when the whole world were clapping for health workers who became victimized, dying in their thousands across the world. When people like George Soros, Albert Bola were making millions of dollars out of the COVID-19 crisis. And I thought there
Hmm.
was something that was wrong somewhere that needed to be right. The clapping that people were doing for the victims in
Hmm.
health workers who were going to work and dying because there were no protective equipments, while others were making billions. These are the winners. They are the ones we should clap for. So I went to Davos to clap for them. And that was why I was there, clapping for them for all that they're doing. And you will be surprised that 2 years ago, the country called South Africa in our
Hmm.
African region and a country from Asia, India, the two combined to make a petition to the global economies, producers of vaccines, they call them big farmers, the big corporations, to waive their patents so that countries that are able to produce these vaccines, they can share with them the information so they can produce vaccines that will be cheaper and will have sufficient across the world faster. 2 years now, big pharma will not do, and because a few governments led by Germany, Switzerland, the European Union Commission, these governments, just few of them are backing these people and they are making billions and people are dying. Health workers are dying. So we feel it is about time to bring the world to attention that you cannot clap for us when we are going to die. You must do something to save health workers, provide for us a safe environment where we can do our job and save lives. And those people who are making billions, let them come to the spotlight. That while we are dying and you are clapping for us, they are making billions and nobody is talking about it. And that was why I was in Divers. And the message was very loud and clear. And I'm sure the world is hearing it.
So who were you clapping for particularly? Were you clapping for the victims or the profit makers, as you said?
I was clapping for the profit makers, who are the CEOs of big pharma corporations. Those were people who pocketed billions of dollars when health workers were going to work dying. And the war as a whole is a victim because we lost so many people across the world to COVID-19. And so I'm trying to clap for them so people can see that there is a need for them to change their approach. Over 100 countries, including my own country, Liberia, is appealing to these people to waive their patent so that countries like South Africa, India, maybe Senegal, those countries that have the potential to be able to produce vaccines they can share the technology with them and they too can produce. So, the more commodity you have on the market, the cheaper the price, the easier it's available. So that this will happen because COVID is not over yet, number one. But number two, and most importantly, the next time there is another health crisis, we need not go back to where we started from with COVID, not having anything to work with, not knowing how to start and all of that. Going back to beg people again for patent. So we are calling for a system wherein it is recognized that in a time of health crisis, there is a patent waiver so that people don't die the way we saw people die in COVID. Imagine people who could have lived their lives, who could still be around, die because of COVID. Some of them did not even die from COVID itself. But imagine if you went to the hospital after you had an accident and the hospital is jam-packed and there's no way to take you in, you die just from minor injuries, bleedings or so. Women in labor could no longer go to the hospitals because they were all filled with COVID patients and they die. And we think this should not happen again in a civilized war of this day and age.
So, was there any response to your protest?
The big guys were all
Mr. Willer, are you hearing me?
in their big hotels. Yes, I can hear you. Are you not hearing me? I am hearing you.
Hello? Yeah,
Can
okay,
you hear
go
me?
ahead.
Yes? Okay.
Yes, I'm hearing you clear.
Fine, thank you. So in Divers, they were all sheltered in the best of hotels, luxurious hotels where they were behind the security barricades. And I went from one hotel to the other because they have many sections, events, and all of that. And I could not reach to them, but I had my placards and spoke to the media, and it was taken. And I'm sure people like George Soros by now will have read, even on Twitter and in the various media outlets that carry the story, like the Guardian from the UK carry it, Business Line from India carry it, people from MSF and other, they call them Vaccine Alliance. They all have it on their web. Public Services International have it on her website. So yes, it is very loud and clear. We did not get immediate response, but what we know is the next day, Albert Bola from FATSA was talking about they are going to give out their vaccines at cost price to about 45 countries from the global south. we think this is a distraction of our call for a waiver of patent, and we will continue. But I'm sure the message resonates with them, and they are taking some action. They are having conscience. They're thinking. But people like you, like this platform, also have to carry the message for more and more people to hear it, and make sure that they see it and receive the message well and understand it well. This is about humanity. It's about saving lives. It's about putting lives before profit and not profit over people's lives, as we have seen in the last 2 years, where Albert Bola alone took him over 20 million when more than 100 million people die around the world. Can you imagine? So these big pharma need to understand, the CEOs need to understand that humanity comes before profit. You
Okay.
cannot have all of the money and people die around you.
Thank you so much, Mr. William. Let's dive into situation as it concerns Liberia specifically. Or you are advocating for the well-being of the healthcare workers in Liberia. I want to know what are some of the challenges in the Liberia's healthcare sector.
Yes, manager, before we come to Liberia, I just wanted him to tell us where he won to see as a result of a protest, probably from now on.
Okay, so
Yeah,
in
okay,
about 2 weeks' time, the World Trade Organization, the WTO, will be meeting in Geneva, where this issue of waiver of patent for medical products and vaccines in time of crisis will come on the table for discussion. I want us all to speak loud and clear to global leaders who are going to be meeting in Geneva in 2 weeks that the original proposal of South Africa and India calling for waiver of patent in time of medical crisis should be brought on the table for discussion, and not the watered down version that they are trying to bring to Geneva in 2 weeks. Let it be the original, and that original must be given green light so that whenever there is medical emergency, there will be waiver of patent so that all countries, everybody will be able to have access to the necessary medical treatment, medical supplies that will save lives, that we will not see again what we saw during the time of Ebola and during the time of COVID-19. So this is what I want to see going forward. And so I'm calling on everybody, everyone who lost a relative, a loved one, or significant other to COVID-19 should join this call. And about 100 countries already are calling, but we must sound it loud and clear before the next 2 weeks, because we don't want them to change it and bring something like Albert Bola was saying they will give at cost, like charity. We don't want charity about this. We want solidarity, empathy.
Okay.
We want lives before profit. Thank you, comrade.
Yeah, that is very good, and we understand that this the solution to some of the problems must start from the big names. We want to go back to our question that we asked previously, the challenges in the healthcare sector in Liberia.
The healthcare sector in Liberia faces a lot of challenges. And we know they all cannot be resolved overnight. We know it requires time to be able to solve these problems. But we also believe that if priority is set rightly, we can make progress in a short period of time, and our health sector will get on its feet the way it should be. To start with, across the country, particularly in the public sector, the lack of medicine drug and medical supplies is very, very huge. People go to the hospital and they will have to do a whole lot to get treatment. Today, as we speak, if anything happens in any community that requires emergency evacuation, or just pick up, not even evacuation, before the ambulance can come for you, if there is one located in your area, like in Monrovia, your family or yourself must provide the fuel oil that the ambulance is supposed to burn from where it is coming from to come and pick you up and drop you to the nearest facility where you get treatment. Can you imagine that? When you are carried to the facility, if you require operation, again, your family must provide fuel oil, gasoline, or whatsoever to run the generator that is going to be on to provide lights for the operation to go on. You are talking about a country where most of the people have to go each day on the street, outside there to hustle before finding daily bread at the end of the day. These are people who do not have money anywhere, saving, and they are spending on health out of their pockets. But when something happens like this, you must pay money on the spot before you can get attention. That is a huge challenge. Let alone the fact that the infrastructure is dilapidated. Ever since the war, JFK we knew to be a regional referral hospital. Never been resuscitated to even halfway what it used to be. Shamefully, JFK have been called nowadays just for killing. And we think this should not be the case. So JFK, where people came from Cote d'Ivoire, Guinea, Sierra Leone, and took treatment. Today, we have to refer people from JFK, even sometimes to Tapita. This is a big shame. And that is a huge challenge. But also, human resource is being very stressed to the extent that our government is not employing required practitioners. We lack cadres of specialists in our country. So whenever anybody is sick and requires special, treatment or specialty, they have to travel out of our country. This was not the case before, and it shouldn't be. Liberia is the oldest African state, and we should be the leader in many of these things. But our health system is so poor, very, very dilapidated. You will also realize that patient to health workers ratio is lacking. We don't have anything like that in Liberia. If you went to work today, you met 16 patients, you have 16 patients. Why are there any other patient they made they come on you? If you went and met 50 patients, you have 50 patients to deal with. And that is causing burnout on the health workers. In the face of the fact that we lack sufficient manpower in our health system, the government went on to retire over 1,000 health workers during COVID-19. Even those who were retired, as we speak, 2 years running, some of them have not gotten their first pension pay. These things are demotivating in nature for the health workers, because our people have the saying that when a hunchback person sees a hunchback dead being buried, they are crying not just because their colleague has died, but the treatment they are going through. They are thinking of themselves. So the same thing. Those who are working now, when they see those who are pensioned, how they are being treated, many of the people who are pensioned, they start getting stroke and they die early. Because first and foremost, your pension scheme cannot help you, because while you are working, getting full salary, it cannot take you home. They now give you 25%. But even to get the 25%, 2 years after you are retired, you are running after the first one. Worst of all, even before you are retired, nobody communicates with you. You will be working for 8, 9 months, 10 months, 12 months without salary. The day you go to the ministry to go to farmer and say, oh, but you don't know you are retired? These are all challenges in the health system. Health workers who have gone to school and have empowered themselves, talking about climbing the career ladder, they are never reclassified in our country. So if you enter the health system today as probably just a nurse with a certificate, you went back to school and get bachelor degree, they don't count you, they pay you as a certificate holding nurse. You go back and get master's degree, they still pay you as a certificate nurse. They do not do reclassification. Worst of all, if you were employed today as whatever cadre of health worker, that salary that you earn in with, you stay with it until the day of your retirement. There is no scenario. Say, oh, you have been here 5 years, we increase your salary by 1% or 3%, or we add $5 on your money. No. For all of these years, health workers have been working since we started having elections in our country. There have never been a time, not just the health workers, but the entire civil servant salaries was structured to say, oh, after 3 years of inflation, we are adding small money to the civil service money. And health workers who are transferred, because most of our schools are in the capital, in the urban area. When you come to school in the rural area, it means you now have 2 homes. The family is living either in the urban area, maybe in Monrovia. They move you to Maryland, to Sano, or somewhere else in Bapulu. You have to rent there while you are renting in Monrovia. All of that comes from the little salary they gave you that cannot carry you home. So because of this, you see, attrition of health workers. Right now, there's something we need to do. We need to start to do a research on number of health workers leaving our country. And if you do that, you will realize, because in other countries like Ghana, Nigeria, where they are doing that, you see the attrition of health workers is very huge. And the same is happening in Liberia. And we don't take time. Time will come, our hospitals will be empty of health workers. So those are challenges that we have in the health system. And of course, when you talk about these things, unfortunately, in our country, they say you are a political health worker. But of course, we have to talk about this because this is the only way the system will improve and be able to serve our people adequately. And we think this is possible. It is very, really possible if we set our priorities straight and we work towards them as a nation.
Thank you so much. Lester?
Yeah. So how
So you went off.
Yeah,
Hello, can you hear me?
Leston video is lacking, but we continue as long.
do you think the National Health Workers Union of Liberia fit why you have the issue of people who are qualified and non-qualified health workers making the same salary?
This is a huge challenge, Lester. You cannot pay somebody. I mean, when you go to work, you are hired in any system, organized system, based on your qualification. And you must also be paid according to your qualification. Unfortunately, it is different in our country. Sometimes people take people because they know them, because of relationship and those kinds of things. And if you do that, you are undermining the system. Remember, this is health sector we are talking about. This is a place where if you don't have the rightful people to do the jobs, you cannot get the kind of a result that you should have in a health system. And what we are talking about is that you're going to have increased mortality rate. if you have costs in the system. But to be very specific, this is wrong to pay people who are less qualified the same amount that you pay people who took time to go to school and get trained, be trained. And this is a huge challenge in our health system. Refusing to reclassify people and the salary disparity that is in the health system, which started as far back as since the war ended. We think this is wrong. And these are all of the issues we are talking about, because this only demotivate the health workers. Because even our constitution says equal pay for equal work. But some people are nurses, they are bachelor holders, they get $100 and maybe $50. Others are nurses, bachelor holders, they get $200 or $280 maximum that they get. And we think this kind of a diversity in salary for the same cadre of people with the same job description is very wrong, and it must be visited and a better system put into place to handle these kinds of issues.
So this appears to be an HO problem. How have you been engaging as hierarchy of the National Health Workers Union of Liberia to ensure that what you've been pushing for is being adhered to and addressed by the government of Liberia?
Very unfortunately, past and present regimes have been very insensitive to the concerns of the health workers. Each regime that comes in will say, yes, the issues are legitimate, they are very genuine, but they have not the political will to address them. And because they lack the political will to address them, they only shy away from the health workers union, and refusing to dialogue is another challenge. You cannot have workers in a sector and you refuse to engage them, as the Ministry of Health is doing in Monrovia. And this is a strategy that they adopted since President Ellen Johnson's leave time. And when President Weah came in, we thought this was going to change. He started on a good footing. Unfortunately, now, ever since some 2 years ago, things have gone down and they continue to slip. And because of this shying away from the workers' concerns, you see how our health system looks like. Because the workers who are the professionals on the workflow, if you don't listen to them, how can you make any changes that will bring about improvement in the system? If the people who feel the heat, who wear the shoes and know how it feels, make suggestions and you brush it aside, what will change anything if you don't listen to them? And that is why the United Nations established the International Labor Organization, which is the branch of the United Nations that deals with workers' issues, work-related issues, you can say labor relations. And they have found it wise that workers and employers should sit around the table and have social dialogue. Unfortunately, in the health sector of the Republic of Liberia, our leaders do not want this to happen. They don't want a dialogue with the workers because they feel coming to the table to talk with the workers, we expose a lot of ills in the system, and so they don't want to sit with us. And so one group will say, oh yes, we will make this gain and reach this far. They will now back off and start to castigate the union, call the union leaders all kinds of names. And when they leave and another group of people come and say, oh yes, these issues are genuine, let's talk about them. When they come to the table and they start to see the truth of the matter, they back off and they start to call us names again. So this is where we are. And that was the reason why since 2016, the union took the complaint of the government to the International Labor Organization, ILO, in Geneva. And most likely, our case will come on the docket, this ILC, that is the International Labor Conference that is about to happen. And we hope our case will be there so that we can face the government before the international body, why they are not willing to work with us, why they are now willing for us to dialogue, to talk the issues in the health sector and find common solutions that will help improve our health system. And that's one of the reasons why right now I am in Geneva waiting for the conference to start, and we will face the Liberian government delegation.
So somebody will say Liberians may make, peer-driven choices, particularly in the nursing field. Is the government capacitated to employ the number of health, nurses, professional nurses in the country currently? Because some of them might have gone somewhere to say, look, let me just volunteer. And at the end of the day, they request, that they be placed on salary.
And that is why there should be a system, Brother Lester.
Mm-hmm.
When we started, I talked about having a patient health workers ratio. Any hospital administrator who knows the intake, the catchment area of a facility, knows how many patients comes in per day, per week, per month, per year, will know exactly how many health workers are needed. Say for Plebo Health Center, you will know how many health workers you need there. When you hire that number of health workers that are sufficient to contain the population, that's what you're supposed to do. And again, I said, if we set our priorities straight, we can achieve this. It is not difficult. No country can employ all of the professionals. But as much as you need that are necessary to carry on a piece of job, it is within the reach of the government to employ. So if JFK needs 300 nurses, the government of Liberia is able to employ 300 nurses for JFK. If Maryland County needs 700 nurses, the Republic of Liberia is able to do that. But if you leave it open, then anybody, any Tom, Dick, and Harris can come in and say, I want to volunteer. And some of the people who come and want to volunteer, they are not the people who really come to volunteer. They are people who are brought into the system by people in the system and say, be here, and after 2 months, I will put you in. So it is because they don't have a system. If you have a system, this should not be a problem. Look, why do you think Firestone knows how many persons she's supposed to employ, and when she employs them, she's not taking additional? Why do you think all of the companies, the human resource department should know what it takes? And this is what we are saying. But because we are saying these things, and they think our talk will block the way they put in people into the system, so that those who have been volunteering for years are still there, but they are employing every year. So they don't want us to talk. And that's why they don't want to talk with us. Because, my brother, why would somebody be volunteering at one facility for 5 years, and in the 5 years you are employing new people, but this person has not been employed? Every year since we started our advocacy, since 2030, the government of Liberia says she employs 2,000 health workers every year from our advocacy. But our same colleagues who have been volunteering for years are still volunteering. They don't want us to be part of the employment. We are not part of it, though we advocate for it. But the people who have been volunteering are still volunteering. And they are telling us that they employ 2,000 every year. So who are the 2,000 you are employing? Where are they coming from? And what's about those who have been volunteering with you in the system? And these are why they don't want to talk with us. They are shying away from us because they know what they are doing. And this is not helping our country. It is not helping the health sector in the Republic of Liberia. The next thing I just wanted to bring in when we talk about some of the challenges. Look, insofar as we need infrastructure, I agree 100%. But infrastructure without manpower, human resource is the fundamental, is the foundation on which you build the health sector. So now I understand a 100-bedroom hospital in Baplu is prepared. Who is going to go there to work? Are you going to take students to go to Bapulu to work in the 100-bed? You put a 100-bed hospital there. You don't have qualified nurses and PAs and doctors to be there. How are the people going to benefit from that? So it's not about building clinics and building hospitals and building schools and children go to school and sit down on the bare floor. It's not about building hospital. People go to the hospital and they get paper to go in one pharmacy to buy medicine.
So are you saying with the number of nurses being trained in the country, people graduated from university and some studying out of the country, Liberia cannot find the number of healthcare givers needed at that 100-bedroom hospital in Bapolu?
Brother Lester, the thing is, to mend the place is not the issue. It is the issue here is, who are you taking to mend the place? One of your questions had to do with qualified people making salary like unqualified people, or unqualified people making more or equal to qualified people. And this is where we are. When the hospital is open, Lester, you please go there after 2 months and carry your microphone and ask people, ask them to show you their licenses as health workers. Let's see who are the qualified people they have there. That's one. Two, ask them, when did they graduate from training? Where have they worked before and are there? Then you go back to Maryland County and go to some of the facilities and ask people and see people who have been volunteering for 5 years and somebody who graduated yesterday having a job and somebody been volunteering for 5 years. I mean, are you getting the picture here? So we have sufficient. Look, in Liberia, we have more than, if you count the nursing schools now, you get almost maybe 20 of them. Almost every university now is taking nursing school. Okay? So we have a lot of nurses around. But of course, we have general nurses in abundance. We need to move a step forward. Specialized nurses that we do not have to our fingertip. However, the general nurses can work. But the thing here is, the government must have a plan. For every 100-bedroom hospital, we are going to have 150 nurses. We have 300 nurses. This 150-bedroom hospital, do we have 200 nurses now? If we have 200 nurses, both close. No more employment of nurses. Do you understand? But you go some places, every day you will see new employee coming every day. I mean, when they say they are not employing, then you see new people coming. And they are coming from the ministry. They have their letters of assignment. And some of these people, they are coming to volunteer. After years, the situation is there that they have not been employed, and then they start to feel demotivated. So this is where we are, my brother. We can get the people if we have a system in place, and everybody who comes, we make sure we employ them. And the next thing is, when these people are not employed and they are volunteering, it's another issue. It's an issue all in itself, because you do not have control over a worker who you are not paying. The person come to work every day, their uniform they're going to wash. They need to get soap to wash that uniform. They need to get transportation to pay their way to come to work. They are living in a house, they have to pay rent. They have to eat. You are not responsible for them. Okay? If this person decides today they are not coming to work, they are going to go somewhere to look for soap money. You as a supervisor, what will you do to this person? After all, you're not paying them. And if this person does not come to work to do what they were supposed to do that you're expecting them to do, you know there is a gap. But you don't have control over them because you are not paying them. And so that alone is a problem. And it's a very big problem. But also, if you and somebody are working together and you take pay on the 28th of the month or on the 15th of the next month, and your fellow friend who are you working hand in hand does not take pay, can you imagine the trauma you feel? You and I come to work, I take pay, you not take pay. I'm smiling, oh yeah, tonight I'm going to drink one beer. And you are there quiet. You have been working 5 years. You don't take pay. So these things cause, a whole lot of psychological problem that our employers are not thinking about. Those who take pay are traumatized, as the people who don't take pay are traumatized on the workflow. So now somebody comes to the hospital. The hospital is free of charge. But this nurse does not have transportation to go home. And they whisper in the person's ear, "Back, can you help me with small 18? Let me pay my way and go home." Will you say the nurse is obstructing money of the patient? These are all the problems that are in the system. And that's what makes the system rotten. So to the extent now, you go to some big facilities where the number is huge. Wilson, you may be very tempted to go and pay somebody something to put you in front to take you in. And it's the person who is looking out for their transportation. Somebody who is being paid knows if they do such a thing, for the small money you will give them, they will lose their big job. They can't do that. But the one who is not taking pay is most likely tempted to do that. And when they start to do that, people who are also taking pay are tempted to follow suit. And then the system is rotten. If you don't know somebody, it's almost like you can't get inside and get treated. And these are the things we are talking about. To be able to control all of these things, employ each and every health worker that is assigned to the facility, whom you have control over. As an HR, you make your work schedule, they keep to it, because this is what they do for their living. Besides the fact that it's humanitarian services, this is what we do for our living.
Okay, Mr. Williams, listen to you keenly, and you talk about volunteering, and most of the volunteers, they do what they want to do. You can't really hold them accountable. I don't think that should be so, because there should be some form of monitoring and supervision. If that is going on, then it means the healthcare system lacks monitoring and supervision, because even if you're intern, you should be monitored. So
Yes, especially nurses who take
yes,
life-saving oath.
especially when it comes to lives, you are taking it's a commitment you have made to even go in the field. It's like you're an army officer. You are committed yourself to death at any time. So monitoring and supervision is very, very important in every sector of the health field. Or having said that, I want to ask a question. Is there a regulation that mandates a regulation by the Ministry of Health that mandate these health facility for training purposes? Like, if you are at hospital B, there should be a mandatory training for your staff at a particular point in time. Or if you are employing new staff, or during a certain period within the employment, is there any mandatory training that the health facility do for their staff?
It is non-mandatory. Sit patient. Patients is not mandatory. It's left to the goodwill of the administrator at the facility, or the head nurse, or the medical director, to see the need to do in-service training and those kinds of things. But it is not mandatory to say you must train. I know the Nurses Association of Liberia is trying to organize some training programs and making them like a mandatory thing for their members to go through as in-service training for career development. But the ministry itself, it is not like that. Okay. So yes, and I also understand when you say people make commitment and so they should live to it. Yes, of course. But in this day and age, my sister, where you have to eat, you have to send children to school. If you volunteer and nobody sees you for so long, and you have to go out a day or two, or even maybe a week if you find some kind of a contract, it's a matter of survival. Look, our people, as I told you, they are very insensitive. In other countries, when you say volunteer, it does not mean you must lick your sweat and your blood. They give you something, but in our country, when they say you are volunteer and you say you won't volunteer, And you will volunteer. They treat you as if it's a crime you have committed. And under that circumstances, if this person, so let's say you are the nurse, you have not taken pay 5 years. This day you come to work and your children call you, Mama, the landlord now can't, the Liberian way. The people say, we must put our things outside. And when you leave from there and come to find a place to put your things, and for 1 week you don't go to work, why is the monitoring that is going to happen on you? After all, if they take the job, it doesn't take anything from you. It doesn't add anything to you. It doesn't add up anything. It doesn't take anything from you. In fact, it's making your condition worse. So people who volunteer in the past, like Florence Nightingale, Florence Nightingale was well off. She had to help patients. She didn't want money. She was like George Soros in our days. So these poor people, when they come and they say they want to volunteer, sometimes it's because the system we have. Somebody say you must work for 1 month, you must work for 2 months. Sometimes people even tell you must give them, they must take 1 month salary from you before they put you on payroll. Those are the things that are constraining some of these people to do some of these things. But it shouldn't be like that. I'm a trade unionist. Labor should never be so. But that's why they are breaking us to. We should sell our labor. So as a result, even the salaries they give to people, it cannot carry you home. You are just there and you're doing it. It's not helping you, but you're doing it because you think of your children, how you will feed them tomorrow. And so they keep you there and you cannot think beyond today. And this is not right. People should be paid fairly. They must be given decent salaries that will take care of they and their families for the work that they do. So that when they go to work, you see, the World Health, when you go by the WHO definition, it is not just the mere absence of fever in my body. It has to do with my psychological well-being, my social and economic well-being. So if somebody is not taking paid and they are working in your hospital, they are not well psychologically because financially they are ill. This person come to work and thinking, what will my children eat? This person come to work and thinking, tomorrow there's a death in my family. They say we should make some contribution. How can I make my own contribution? And so they are working on this patient, but their attention is not on this patient. Their attention is whom? My children have not eaten since day. So yes, they are committed, but sometimes you get to the point, the breaking point, and you have to do otherwise. And I tell you, some of the people who do these things are professional people with passion. But when they are pressed, then survivor of the day will make the decision at that point when they have to leave and go take care of their children and take care of their family, because today they cannot come to work. And if they are not coming to work today and you were expecting them to come, then you have a gap. But when you sack them, this is where the question comes in. As a supervisor, you sack the person, they don't feel it because they are not losing anything. They never had a contract with you that they are losing their salary or their pension scheme. Nothing, absolutely nothing. And that is not right. And that's why we stand for to say as a union that all of these people should be employed so that there's a way to monitor them. Then you have a work schedule that they will have to fulfill. That is a contract, a social contract. We will do this, but you will do that. It cannot be you do this, you do this, you do this. And you only come as a boss and shout at them and shout, even when they come late. You are not even asking why they came late. This person had to walk some of the distance because they do not have the full transportation. So they walk some of the distance, get ahead of the road, maybe by 50% or 25% before they can take a car or a motorcycle because they are not taking pay. And our country should not go this way.
Yeah. Even though I'm not attributing all of what you are saying to this, but there are might be other people who are in the habit of, abusing employment. Take for instance, you are employed and you abandon job. Sometimes you don't live within your, ethical, confine. Like you got this kind of misapproaching patients and maybe charging fees, all of that illegally. Do you see that as a challenge also? And is your institution working towards that?
I tell you, in every system, we know there have to be some bad apples. And such bad apples must be weeded out. And the union is for that. You will see that about a year and a half back, there was some issue at JFK with one Liberian sister in the USA called Sister Tewa, something like that. She sponsored some children treatment at JFK, and there were some issues. She had some issues with that. It was on the social media. We saw it and we stepped in as a union. We wanted to dig up the story and get to the bottom and see how this could be resolved. We contacted the workers. We contacted her. Along the line, we got to a point and she slacked up. She stopped pursuing the case. And the information we needed, she could not provide. We had gone as far as the Liberian Senate. We got the lawmakers involved. That's how serious we were with the case. But what the lawmakers wanted to prop in, she and her party decided to play it low. And so then that case died. So we as a union, we are aware that there are some bad apples. But we are not defending any such attitude, because this is a professional organization, professional body, your work. This is a profession that you choose to do, and you must do it, with utmost conscience. So if anybody is being unprofessional, practicing unethically, we are against that. And when we see them, we put them on the spot. We have our different professional associations that license them. We send you to the board for investigation. And if you are found guilty, you could lose your license. So yes, those who do that, they take a high risk. But the day it gets to us as a union, we will take the necessary steps. But to not give room to these kinds of things, that's why we are calling on employers to first and foremost make sure that there is a regulation. If somebody is coming here as a nurse, as a health worker, let's know that this is a health worker. They have this qualification. They have this licensure. We should also know that they are taken care of so that they don't have excuses. Because when they are not taken care of, they are volunteering. Then the day they supposed to come to work, they say, oh, I had to go do something. Then we cannot push them that hard, because we ourselves, we are human beings. If I take pay and you don't take pay, how do I feel the day you have to go hustle somewhere to buy food for your house? Then I say, oh no, we do this to you because you did not come to work. No. But if you are paid, my brother, to do a piece of job and you did not do it, then there's an issue. But where there's this understanding between you and the employer, a gentleman understanding, they now pay you, you can't come to me and complain and I lash at the employer. In the same way, if you did not do something that she wanted you to do, I will also understand, because you have a genuine reason. Oh, my man, I didn't go because I went to look for something to pay my way the next day. I never had transportation, so I had to go look for transportation for the next day. Then what can we say there?
So
Mr. Williams,
yeah.
Mr. Williams,
yes, ma'am.
let's not ask a question where I want to paraphrase that question.
Please.
I've heard a lot of stories about customer service when it comes to healthcare workers in Liberia. Not just a few apple, like the way you try to make it sound, moderate, but it has raised a lot of concern. The way healthcare workers in Liberia treat the patient, it is, it is alarming. And so my question here is, are there laws that hold healthcare workers accountable in Liberia? Are there laws? Because if there are laws on the book, the administrators of those healthcare facilities should be able to bring the people we are talking about monitoring and supervision again. They should be able to bring the people to order. But if things are happening like this. It's like all over. They are very selective in the approach to healthcare. That means if you got money or you got something to give them, they treat you fast, and your service, the service you receive, is going to be adequate. If you don't have that money to bribe them, you are last on the queue. I mean, the way they talk to the healthcare the patient is nothing that they learn in school or during the training. Nothing like that. You being the advocate of these people, is this something you people discuss when you come together? And is there any regulations that penalize healthcare workers when they do these things?
Exactly the case. The first thing is, patients, I am not trying to sugarcoat the issue that have to do with customer care. I said it very plainly, giving you the example when we saw one case on the social media, and I told you we have even gone at the level of the legislature. That is how serious we took the case. These things will happen. Some family members will say, "Oh, we leave it; it will not come up." But when it comes up, I tell you, we take it very seriously. With regards to regulations, yes, each professional group or cadre has its own board that is responsible for ethics. At the level of the ministry, they have this professional code of ethics. Yes, these things are there. But like you are saying, it's the same thing that I'm saying. When it comes to regulation, the union is not in the business of regulation. That is the employer. This is one of the shortcomings of our employer. And we who are supposed to even be the one backing up, we are the one who proffered the issue. The case from JFK, we were in the media. We went from one area to the other until we reached to the lawmakers, the Committee on Health, both lower and upper chambers. This case, you can call any of the lawmakers now. They will tell you that yes, the health workers came here with this matter. But again, the very JFK where this happened, to this day, administration had never even tried to find out what happened inside the building to see if the clients were falsely accusing the workers, or the workers may have made some mistakes. Up to this day, that had not happened. It was the union that took the steps. But again, the very family who brought the case up defaulted. And then we could not make more progress at the point where the lawmakers wanted some clarity, some documents from them that they did not present. So we are not backing them. But yes, again, I say in every situation, you will have some good and some bad. Good over evil, we take. But when we have a case come out that can be proven that one of our members had done something out of the professional ethics, we send them to their ethic board and they will take care of them.
So let me follow it up. Like the President of Liberia, why it is true that if you go against an individual, probably you went out of your professional practice, why it is true that the person may be taking you to court, but the union has something like punishment to give you. Are there any provision in your bylaws and constitution as the National Health Workers Union of Liberia to have somebody accountable for any unethical practices ranging from job abandonment, approaching patients, and maybe the sale of public materials like the medicine, where the person will say, "Look, I'm the ORC, so I have the right to put any medicine in my bag." When you have a number of partners working with the Ministry of Health.
Yes. So again, the Health Workers Union is a conglomeration of all the different cadre of health workers, medical doctors, pharmacists, nurses, nurse anesthetists, midwives, drivers, and so forth. Each of these sub-branch has a board for professional ethics. So in the union, when it comes to our attention that at this hospital or facility, this malpractice was carried on, we immediately step in to see the merits in this accusation. If we found it out that it was a nurse that was involved, we sent you to the Nurses Association. They have their code of ethics. The nurses' code of ethics is different from the doctor's code of ethics by which they will judge you. So we sent you to your board, and your board will look into the issues based upon what you and them know that's supposed to be the proper approach that you should have taken, and they will deal with you. So at the level of the union headquarters, we do not have an ethic committee there, but our vice president for administration looked into these things and sent you directly to the division you fall under, and that division will look into the matter and give you the verdict as it should be.
So, do you believe that all of these irregularities, like the unethical practices, are some challenges in the Liberia health sector?
Of course, they are. They are. These are some of the challenges. But again, like I keep saying, if any such issue comes out, we will look into it on a case-by-case basis. So if a PA is involved, we send you to the Liberian Physician Assistants Association. If it is a medical doctor, we send you to the medical the Medical and Dental Association. You see? So that is an issue. But again, our society is such that people will always waive this thing. Oh, I don't want it to be my name that he is or she is going to lose her job. So many times people say they let it go. And when the person who has the issue that's supposed to provide evidence say they let it go, my brother, what can you do? You cannot prosecute without evidence. So take, for instance, at a facility, they say the ORC took medications out. Somebody must have seen the ORC to bring this thing up. Now they brought it up and you start to investigate. You reach a point they don't want to speak out again. And you don't have the information sufficient to prosecute. What can you do? And this is where the problem is. So this problem is like a cultural thing. In Liberia, everybody knows everyone. Nobody wants to be the fault for somebody's facing justice. And it hampers everything. So if people could come up to say, I went to the hospital and this nurse took money from me, and you can stand up for that, my brother, we have somewhere to start from. But all you hear, oh, the nurses can take money from people. Oh, the nurses they don't know how to talk to people. But nobody.
And sometimes it will not be the cash taken from you. Sometimes they will tell you that this particular medicine is not here, and I can direct you where I normally buy it. And that could be their drugstore or pharmacy.
Exactly. So my advice will be ask for receipts. And you can use that as an evidence that I went and you show me to this place and I went and bought this medication and this is the receipt I have for it. But then I see on the pack that not for sale. You getting the point? Yeah. But we have this kinds of documentation because you see, the law is blind and everybody is assumed innocence until proven guilty. So if we just say, oh, somebody came and said one nurse took money from patient or they sent patient, it is not sufficient to prosecute. It's not sufficient. And sometimes the person will tell you, but my Nemo, if you are saying your need, how can I go forward with this thing? Because I cannot go and accuse Lester when I don't have somebody to say, this is what Lester did. I was not there. to say, okay, Lester, I saw you doing this, or Lester saw me and say, George, you did this. Somebody is telling you, but the person is not willing to tell you further. And it becomes very difficult, very, very difficult. I say, I just gave you a very classical case. A sister in the USA, she had posted photos on social media. It claimed our attention. I went to do advocacy in Germany, and somebody showed me some of the pictures on social media. I immediately placed a call to my people back home on the ground, and we took up the case. We went to the level of the committees on health. But
you
then
see,
the person,
Mr. Williams,
Yes.
that is where we have problems. Because if an issue is raised in healthcare sector, the first thing is the Ministry of Health should be the one prosecuting that case, not the union anymore.
exactly the
Ministry of Health
case.
to take up that case, first of all, they should open an investigation. It should not
Exactly.
be you taking a case to or the lawmakers to go. No, what's the duty of the Ministry of Health? First of all, you have to look into the case. You have to suspend the person while investigation is going on until you find, whatever is the truth in the case before you can come to a conclusion. But meanwhile, they have to be the one that take up that case. That's how it should be.
Exactly.
So if the Ministry of Health is not doing that, so how will cases be prosecuted? If you come and report somebody, even like in the diaspora, if just the patient complain that this is what took place, you are suspended until investigation is over.
Exactly.
And they will go into that case. Your facility is going to forward the case. They have nothing to do, even in the event where worker union is present. The worker union will know about it. The case will be forwarded to Ministry of Health, the Department of Health. The Department of Health launched an investigation. Everyone concerned, everyone on the shift will be questioned.
Exactly.
So if something like that happens, the Ministry of Health should be the one investigating, not you. You are
Exactly.
party to the investigation though, because you
Exactly.
represented them. But they should not, having said that, I want to look at the other side of this whole thing.
Yeah. So just before you go,
Yeah.
let me show you why we had to go to the legislature. It was because we were trying to bring JFK administration to the table to open a file on this case, and they didn't want to give us credence. That was why we're invoking the authority of the committees on health, because they have jurisdiction over them, to compel them to open this case up for investigation. So they wanted to see what the complainant had to be able to use, and the complainant did not bring it. So they could not now call on JFK administration to open the case. That was what we're doing. And like I said before, you said it again. When it comes to the issue that have to do with monitoring, it is not the union, it's not us.
No.
But we have to step in because we want to make sure that our field, our professional, ethics is held up to, and that stain that people are trying to put on us, that all the health workers are not good, all the health workers are doing, we are fighting to clear it instead of the people who are supposed to monitor. So you are quite correct.
Let me ask a question on the picture you said she posted.
Yeah.
She posted the picture and she said this is what happened to her, Reddit or whoever it is at the hospital, right?
Yeah.
And she cited the name of the hospital that it happens at.
Yes.
So that began the case of the Ministry of Health.
But they were not picking it up.
They should have been the one to cite the administrator of the hospital. This girl that said whatever the girl had provided evidence already. It is no longer you here. People like to compare bad things that happen in Liberia with America. Now we should also make that comparison to the good things that happen here also.
Exactly.
So if you see that kind of picture, if a health facility see that kind of picture here on the internet, everybody on that shift will be questioned.
They didn't care.
Everyone.
They didn't
That
care.
investigation, it is no longer in the hands of the facility anymore. It is the Department of Health that will take over.
Didn't care.
So it means
the union wanted to clear her members up. That's the problem. That's one of the issue we have here.
Yeah, like I said, I wanted to turn the question the other way around. What happened to the healthcare worker in the discharge of his duty And when I mean his, I mean he or she, of his duty,
Yes.
in the discharge of your duty, and something happened to you, what do they do? Like
This
maybe
is this.
our, you get infected maybe by some accident, by blood pathogen or something, or maybe the patient, become violent or something happened. What happened? What happened to them? Or what kind of course of action they take?
It is very saddening to know that absolutely nothing they do about it. In fact, you are blamed. The health minister before the current health minister, she was the chief medical officer at the time when there was Ebola in Liberia. Then later she became the medical, the health minister proper, Dr. Bernice Dan. When our colleagues at Redemption Hospital were infected with the Ebola virus, she went there and said it was due to their negligence. When they did not have even disposable gloves,
The PPE.
there was no PPE. We're not even talking about PPEs, my sister. I'm talking about disposable rubber gloves, latex gloves that you use one time and chunk in it. They did. We used to wash them. Even to this day, people still wash them sometimes.
Jesus.
Yes, in Liberia. So she said it was due to their negligence. When these people were not trained, they had no gloves, they had no running water to wash their hands. That passed. The current Minister of Health, Dr. Wilhelmina Jala, female again, when COVID came and some health workers were getting infected, she again repeated that very statement. That is just to prove to you how insensitive our ministers or decision makers are to the concern of the health workers. If you were going to work and you got involved in an accident, it is your own fault. It's left with you to fight. So we have several examples. In Bomi County, there were some two colleagues who were volunteering, doing vaccination. They were going on the field, and there was this accident. Those guys lost their lives, and that was the end of it. At Phoebe Hospital, there was a nurse. She was also volunteering, going for, that was a midwife, going for a patient, labor patient. Ambulance had accident. She was involved in that accident. She lost her life. Nothing ever. The only good thing that happened is that there was a canteen at the CB Doma Hospital that the good administrator later on named in her honor. That was all. What happened to you? Even if you are sick and we go to work, they query us if we are slow in treating patients. But when we get sick ourselves, nobody cares. In the very hospitals where we work, there is no place to say, oh, if staff is not well, let them go over there and rest. Even you're going to work, your child is sick, they want you to go through the regular chain, but they want you to be on to work on time. My child is sick. If I have to go somewhere to treat this child in a regular queue, how am I going to be here on time? Those things nobody cares. So in the overall run, what they did is they said the civil servants should be responsible for their own Medicare. So then every ministry and agency must have this thing they call group insurance, medical insurance. So those of us in the Ministry of Health, we have a group medical insurance. They cut some small money from your salary. So if you are sick or one or two of your dependents or your spouse sick, you can go and take treatment. But apart from that, nothing. Absolutely nothing. And these are the things we are calling for dialogue, social dialogue, for with the employer, government, and us. And they don't want to listen. They call us names because they don't want to They feel we are troublemakers. We are talking too much about the health workers' issues, so we are troublemakers. But these are things that help the system to be good. Because if you give good care to the staff, that is motivational. They
That's
can
right.
work hard and the productivity increases. Unfortunately, it's not the case, my dear.
So can we go to the prospect
The prospect.
in the Liberia health sector? Yeah.
Yeah. Yeah. So, quite frankly, the health sector has a lot of good things that we can talk about, and
Mhm.
people could go forward to be able to to tap in,
Yeah.
you
Mr.
know.
Williams.
Yeah.
Yeah, before you go general, I want us to begin with salaries, insurances, let's say, yeah, insurances, maybe wages, resettlement packages of health workers. Then we go on the general level.
Okay. So you see, on the level of say wages, if our government is willing, there's a good prospect that the health sector, you can first and foremost come on the round table and see how to restructure salaries. If you pay doctors well by their category and say the non-service
Yeah.
seniority, you do that for all cadre of health workers. If you are in this category, say you have a master's and you're working this much, you have a bachelor this much, if you have worked this long, this much, those kinds of things, you see, it will even help to retain workers. Workers who enter will want to stay to reach a level to earn certain amount in in pension scheme and all of those things. That's a good prospect. It's a good prospect if you start to pay people by their level of education. Everybody will want to advance themselves. That is, you are setting career ladder. You will see people will want to get the best knowledge so they come and serve well because that will earn them more. They will be happy. And the next thing you will see is the idea of how people want to work here, there, yonder, because they are looking for a way to make ends meet. That will cut down. People will be more focused. Work in one facility, put all my time in, and do a very good piece of job because I'm taken care of well. So, just a good prospect if salaries are looked into, structure rise, and we have a kind of a pay scheme that commensurate with knowledge, experience, and loan service. We can also look in the fact that, in the direction of the fact that there are a lot of partners in the health sector. These partners are helping to do certain things, or probably they need to come together and see, do like a fund, pool fund, where everybody comes in, whatever you have, you pull it together. And then we can use that to look out for those things that are needed on the region by region basis, facility by facility basis. So take, for instance, malaria is one of the common disease conditions in our country. Are we able to procure sufficient medication for malaria for a year so that from the start of the year, we know we have sufficient for throughout the country? We also know that some counties, like in the southeast, these counties are cut off during the rainy season. So just before the rainy season, can we do a bulk supply? We supply for 6 months because our rainy season lasts for 6 months. So just at the beginning of March, can we supply for 6, 8 months so that these people don't go out of drug? Because if you have the money in bulk and you buy in bulk, it will be even cheaper. And then you have sufficient on the ground, you can distribute. But of course, then you also have the control system. Sometimes people say the nurses, they can take the medicine. For me, I'm not saying nurses don't take medicine, but to say because a nurse took 1 or 2 paracetamol in their day, that is why no paracetamol in a whole hospital. My brother, can you imagine that? Eh? Is that why no paracetamol in a whole hospital? No. You can't say that, man. So we supply in bulk and make sure there's a good accountability. Every piece of tablet that leaves the pharmacy, we know why it left, who it went to. I mean, there must be a prescription for it from a doctor. Okay. We can also look at the fact that if our government is really, really well that we say health is wealth, so they prioritize health, can increase the budget of health, increase the budget allotment for health, so that we can get these things that we need to get. Look, imagine during the time of Ebola, you have to take specimen initially from Liberia, either send it to South Africa, the nearest, or Senegal. Otherwise, it will come to Europe or America. For heaven's sake, you're doing a test on somebody with the kind of a condition we're talking about. It have to, a plane not coming every day, you know that, in Morovia, those days, plane not coming every day. And how much at that time was for Ebola test kit? 5,000. The whole Republic of Liberia could not find 5,000 to have one. So it's setting our priorities, and working towards that. The health sector, there are a whole lot of goodwill in the health sector. People are pouring in, but we need to coordinate what they are doing. So you don't have partners who are working with you. You don't know what that partner is doing. You don't know what this partner is doing. They are doing things, but you don't see the benefit. You don't see the impact. Let's coordinate these activities. If you are coming to work with our, say, AIDS program, let's see exactly that you are working with AIDS program. Let's see what you want to do in the next 3-5 years. Let's see your plan of action monthly or quarterly and annually for the next 5 years. Let's see if you are hitting your targets. You don't say because this person brought their money and they are doing their thing, let them just do it. No, they brought their money to help you. So let's work together and see what you want to do, if it is in line with what our own plans are. And then we see periodically what progress we are making. None so, somebody will tell you they're going to dig wells, and after 5 years, you don't see one hand pump. Because you must know, if you are coming to dig hand pumps, how many hand pumps will you dig every week? At the end of 3 months, how many hand pumps have you dug? Can we see where they are? These are the kind of way you monitor, and evaluate, and then you see progress. But if you leave everything, the men say he's taking care of Southeastern region. Whether in Barclayville, he ever went there to deliver once, you don't know.
So we are yet to talk about the good side of the health sector.
The prospects.
Yes, these are the prospects. I'm saying that I'm just trying to, the prospects have their own side effect that if you don't take care of,
all right.
the prospect will still turn into a woe.
That's true. Within all the challenges, there are opportunities that are there. Exactly. But having said that, William, time is fast spent. We want to look at some of the questions that people are asking in the background. Do we have data on drugs taken by healthcare workers at facilities? Somebody asked. Is there data on the books?
There is data. When you go to the various hospitals, I think it was in the days of John Molu, if I'm not mistaken, when they drew these kind of rosters to enter patients and what their diagnosis and what prescriptions are made. So those data are there. Data collectors are taking those records. They take the charts and see what you took and all those kinds of things. Unfortunately, Liberia, like people say, and I really think it's truth. If you want to hide information from a Liberian, write it down on a paper. So I think these people, they are not utilizing that information to help improve the system. Because if you go to that database and take out, say, how many patients took malaria tablet this month, this quarter, it will inform you how much more you need to purchase for the same period next year or the time ahead. But those things, I think they just writing them and packing them in some kind of bag somewhere. So yes,
Okay,
my dear, there's data on that, but it's
okay,
not being properly used.
okay. Deston
So,
asked a
so
question. How many
yeah, go
times
ahead.
does how many times does the Ministry of Health take up cases like that? He's referring to the case that you made mention of. And he also talked about people taking medication and they got their own pharmacy and so forth. You want to respond to that?
Yeah. When it comes to the case we talk about, you will know the ministry never ever takes case up at all. That case we are talking about was one of the cases that we thought the ministry would have attracted the attention of the ministry, because photos were on social media. Family were complaining, and we thought the ministry would take interest. When they did not take interest, the union came in. The union came in. A JFK administration refused to answer the union. That was why we took them to the lawmakers to force them to be able to come to the table to open this case. But unfortunately, our sister backslided and then it went down. But you will see that the ministry never takes up any case like that. On the case of medications taken by nurses or health workers, I don't know of any data that specify how many times nurses took medications and those kinds of things. But for me, I recommend that with these documents we have, where patient prescription is made and all of those things, the regulatory authority should be able to follow up these things. Because if you supply and the way it is used is being, catalog, you need to go into that catalog and see if what you sent is what was used before you were told again that all is finished. If you do that, you will be able to know if there is a loss. If there is any wastage, we will now come to be able to ask people what happened. We brought
So I
five.
think the citizens have,
Hello?
a role to play, because like for instance, some of those supplies that partners bring for, sometimes malnourished children and, like rest, you find them in the market and the same citizen turn around to buy them. They do not ask any question, report such cases.
Exactly. And it is in two folds. One, it could be the people who are supposed to issue it to the recipients who are selling it, or the recipient receive it and are selling it. One of the two. But there is a need to monitor and see exactly how it ends up on the market. The fact of the matter that this item is marked not for sale, not to be sold. When it comes on the market, we should not be in the front to buy it. We should be questioning. Even state security should step in. But along the line, monitoring and evaluation is a challenge also.
So do
Okay.
we consider the 100-bedroom hospital as a, prospect?
For me, as a trade unionist, I see this as a very good thing. We need hospitals across the country, but I'm only concerned about the political will. There must be political will to supply that hospital with manpower and medical equipments and other supplies, logistics. You cannot build a hospital way in in how you call it, how you call it, it's
Bapulu.
not Lofa, it's in Bapulu,
Bapulu.
and they don't have an ambulance. If there is a hospital in Bapulu that does not have an ambulance, how do they refer patients? We get a case that we cannot handle at this hospital. Do we tell the people, oh, you go look for motorcycle and carry a person to JFK in Monrovia? So there must be, I mean, I don't know if I'm bringing it out to you to understand.
You are.
Exactly.
You
These are
are.
the things, these are the things we're talking about.
Yeah.
So it doesn't make sense to build one fine house and no chair inside to sit down. And you're calling people for party, let's go to my new house. No chair to sit down. That's what we are talking about. So yes, we have a 100-bed hospital in Bapulu. Oh yes, I'm happy for that. Okay, but will we have what it takes for a 100-bed hospital to operate? It is not like Europe.
Yeah.
It is not like Europe where you have helicopter airlifting patients for referral.
From one place to another.
Yes.
Anyway, time is fast spent, Mr. William. Let me ask one question outside your purview. I mean, it's a medical question though, but as a unionist, maybe there's some information. Why there's a post that someone, yes, a comment someone made on the post that the BCG vaccine has not been available since 2020. Is that true?
Since I'm not on the ground, I may not know that very clearly. I don't have the information on that, but I will research on it and I will inform Joe. He will get back to you. But I quite don't know. Okay, I see that somebody is saying it hasn't been available. Oh, this is my able lieutenant from he's my secretary for Bombay chapter is saying BCG hasn't been available in Liberia since November 2020. And I can put my hair on chopping bull. Once he said it, it's the fact. That's the person I was going to ask. And he have already said it. So yes, it is not there. It is not there. My sister, even the health workers who are working, one of the reasons we strike before was for vaccines. Health workers are working with patients of hepatitis, and there was no vaccine for health workers and those kinds of things. And when you talk to the people, say you are a politician, you're a medical politician, nurse politician. No, we're talking about people's lives. These are the people who come to save people's life. Just like we say, no woman should die while giving life, while giving birth. So too, nobody should die while saving life. Unfortunately, the people who are working, they are working barehanded. Nobody cares. And when you talk it, then they call you name, they are ready to fire you. These are not right. And so the union is open for dialogue with the government. And we hope the government is going to open up for us to be able to discuss so that we find common solution. Some of these things, the hanging fruits are there to pick. But certain people mislead people at the upper level and make them to think we are bad people when we are advocating for the right things to make our country good. How does it feel every time you have a small case, you're going to Ghana? Okay, what's about the people who can go to Ghana and India? A lot of Liberians cannot afford to leave Monrovia for treatment. And this is what they have to go to JFK. But they go to JFK, you have to write prescription. They must go across the road to buy even paracetamol. The cheapest medication.
Thank you, Mr. Williams. Lester, you want to say anything before we come back to Mr. Williams for his closing statement?
Well, I think he can go ahead.
Okay, Mr. Williams, you want to close?
Oh, thank you so dearly for having us on your program today. As we close, we just want to call on our leaders in Monrovia to see the need to prioritize the health sector. We say health is wealth. And so for our people to be wealthy, they must be healthy. Our health sector is down. We really want to thank the government for the hospital in Bapulu. for even the 14 military hospital, and for the dialysis department open at JFK. But we think more needs to be done. And we think the way this can be done is to add up to the budget allotment of the health sector, employ more qualified health professionals, and also make sure that whatever is put in the health sector, accountability becomes the moral operators. And that is where I want to end. I thank you all, but also the whole wide world. Let's join hands to call on big farmers to waive patents on the production of medical supplies during the time of health crisis to save more lives. Let's put lives before profit. Thank you so much.
We want to say thank you, Mr. Williams. Thank you for the information. I mean, it was good having you on this platform, and we will be calling on you again. This is just the first time. We're going to be doing some follow-up discussion in the soonest possible time. We also want to say thank you to our correspondent in Maryland, Mr. Lester Wilson. Thank you for all you do and for the hard work. I want to say to our viewers out there, you have heard the discussion, and those that will hear it, there are a lot of prospects in the health sector in Liberia. Whatever you can do to help will go a very, very long way. And we are also calling on the administrators of the different healthcare facilities. Let there be some monitoring and let there be some kind of supervision increase. I know you are doing that, but we urge you to do more than what you are already doing. And to the government and the Ministry of Health, we want to say, I mean, the health sector will not prosper. It will not be the way it ought to be if you don't do what you should be doing. So we want you to look back, look at your books, do all you can. The health workers, they are the front line, on in the battlefront as it concerns the health of the nation. So do what you can do to make the work more easier, provide the necessary equipments, the necessary resources, and everything that make health a better healthcare work, a better one. And so we want to say thank you for everyone out there, and we will be coming back and doing some follow up on this all important issue, the health sector in Liberia. We want to say thank you to our viewers out there. Please continue to share the video, and you can also continue to send your questions or make your comments on the broadcast. And our email and our website is also on our page. You can contact us anytime, and we'll be glad to respond to your inquiries. Thank you, and have a great week.